Contact tracing isn't new. It's been used for many years worldwide. The fact is that contact tracing helps prevent the spread of infectious diseases like the coronavirus. An NHS contact tracer will call you if you've tested positive for coronavirus. Our team will give you information and support to help you self-isolate and look after your mental health. A close contact is not somebody you've passed in the supermarket or on the street. It's somebody you have had spent a significant amount of time with.
This could be people that you live with. It could be people you've spent considerable time with in your home or theirs, who you've been face-to-face with without social distancing. A close contact can also be someone who's been in contact with you for more than 15 minutes at a distance of less than 2 metres. This could be your friend who you were with in the pub, or someone you've met for coffee. The contact tracer will decide who your close contacts may be based on the time you spent with them and how physically close you were.
Before your call, you may get a text to let you know you'll be called by NHS Scotland. When we call, it'll be from the number 0800 030 8012. When you answer, we'll introduce ourselves, tell you why we're contacting you, and address you by your name. If you get a call, it's best if you're not rushed. Find a quiet place and grab a pen and paper in case you need to write anything down. If you've tested positive, you'll be asked who you live with, who you've been physically close to recently, and where you've been. We'll decide which of these people may be infected, and we will ask you for their names and their contact numbers. The information you provide is completely confidential. We won't pass on your identity unless you give us permission to do so. All information collected is stored safely and securely. We will not ask you for your bank details, payments, or personal information such as your passwords or your PIN numbers. If you're unsure if the call is genuine, then ask the contact tracer if you can call back.
To make the process as easy as possible, there are options for you. If you're unable to talk when we can call you back at a better time. If you don't speak or understand English, we can arrange an interpreter to help. If you use British Sign Language, you can contact us using the BSL Video Relay Service. If you see a call from our national number 0800 030 8012 on your phone, please don't ignore it. Pick up the call and help us stop the infection from spreading. We know this is a lot to ask, but we all have a responsibility to keep ourselves, our communities, and our loved ones safe.